Well, good day, everyone. Hope you are well today. This is Mental Health Matters on the Jefferson Exchange. I'm Andra Hollenbeck with NAMI, the National Alliance on Mental Illness, Southern Oregon. And when we talk about health, we can't discuss complete health without talking about our mental health. And on this program, we highlight mental health issues in our community and ways we can improve mental health for everyone. Today, we're going to be discussing particularly youth mental health with Mike Pazzini, a clinical outreach specialist from Charlie Health. Good morning, Mike.
Good morning, Andrea. Thank you so much for having me.
Yeah, thanks for being on the program today. So, before we jump in to Charlie Health, tell us a bit about yourself and your own background and how you came to mental health work and specifically to be a clinical outreach specialist at Charlie Health.
I am a Southern Oregonian at heart. I've lived here my entire life, working in all kinds of fields. I actually started out working in the golf industry. I still teach a lot of golf, and I love playing it. But through my, I guess, journeys in education and going to school, I found a really big passion for helping people learn, and that was something that helped me. When I got into a career in higher education, and I helped people accomplish their dreams.
Oh.
And it didn't take long for Southern Oregon and the need for more mental health resources, where Charlie Health asked for someone in Southern Oregon who is kind of integrated in different levels of healthcare, as well as very passionate about getting people connected to their next step.
Yeah.
Now, in education, it was their dreams. Sometimes in mental health, it's helping people connect with resources in their worst times.
Hmm. Yeah, so you definitely have a background with young adults and youth, and there's a sense today that young people face particularly unique challenges with their mental health. What have you seen are some of those challenges that seem to be unique to today's youth?
Well, I want to start by saying I'm certainly not like a doctor or
Hmm.
someone that is going to like diagnose
Sure.
individuals, but I can speak to my experience in the community. Every day I speak to families and their youth about the challenges that they face. And a lot of them are not going to be a surprise to you. You know, social media and artificial intelligence have made it a lot easier for our youth to access information. And there's a lot of schools of thought about should youth have access to all informations out there without, proper types of filters and things like that. So certainly, like online is kind of a dangerous place. But I do know in Southern Oregon as well, we do have very serious mental health, behavioral health warnings that happen in our schools as well.
Mm.
And these are places where maybe the family doesn't know about what's going on, but a school counselor might or a teacher might, and they're ones that are also kind of tasked with how do I help this
Hmm.
individual?
Yeah. Yeah. So Charlie Health is kind of an unusual name for a mental health service. And I understand that Charlie Health has taken a distinctive approach to providing youth mental health services. Tell us a little bit about Charlie Health and what makes it different.
Yeah. Charlie Health is, of course, a lot of things, but I think most importantly, we are a mental health provider designed to help save people's lives.
Mm.
We, from the beginning, were designed to help people that face a lot of challenges to access care. Charlie, our namesake, is a friend of our founders, whom was accidentally in an overdose situation,
Oh.
right? And they were an individual that was actually waiting to get into treatment.
Mm.
And that was the big barrier for them was a wait list.
Okay.
Insert Charlie Health, where we're able to provide an access to care in their name to say, if you're on a wait list but you need help, you can get it. And I think that's a really important thing in this community, as of course we hear wait lists all the time. We have communities that are far removed from Ashland or Medford,
Hmm.
so getting access to your doctor is very challenging. So I love what Charlie Health does because it has a very important mission to save people that need it most.
And how does Charlie Health help people get that access, especially from a lot of different areas?
Yeah, so I'll zoom in a little bit from saving lives, right? And what exactly does that mean? We provide a virtual platform for people to get individual and group sessions. Okay, and we get these very, very curated to what's going on in their lives,
Hmm.
what's going to be the best way to treat them. But imagine everyone that comes to Charlie Health being enrolled into group led, peer led their sessions,
Hmm.
as well as individual sessions by a provider based here in Oregon to help them um, conquer and overcome some of their obstacles. You know,
Hmm.
we work with people in Southern Oregon that have a therapist, but I remind people that Charlie Health is for those that need more than weekly therapy
Mm.
and they may be considering or have experience with hospitalization. Charlie Health is that middle ground between weekly therapy and
Oh,
hospitalization.
okay. So
hmm
it does deal with the sort of the critical needs and maybe more intensive needs than what might be considered in a regular outpatient type situation.
That's exactly correct. You know, some of like the clinical terminology I use is intensive
Hmm.
outpatient,
Yeah, yeah.
and that's kind of our formal terminology that we use. I work every day with local providers that have youth, both kids, teens, and adults that need more than weekly therapy, and I handle the care coordination efforts between
Right.
what Charlie Health is doing every single day with that person, and then what that local clinician might be doing weekly.
Yeah. So people can get their needs met, even though they might be a higher need at a particular point. Tell us a little bit about, you said the curated groups. What are some examples of the specialty groups that Charlie Health has?
Yeah, so we focus really strongly on making sure time is a big consideration for our people. We know that people work and people go to school. Okay, so we want to get them into a schedule that works well for them. If they're a youth and
Mm.
they need to attend after school, let's do it. If it's summertime, they have more morning availability. Let's do it. But we
Yeah.
also will have clinically appropriate group sessions that might be focusing on DBT skills or CBT groups, as well as our populations that are needing very specialized care.
Right.
My favorite one is our mental health programming,
Oh.
maternal mental health programming,
Uh-huh.
where someone that is pregnant or been pregnant in the last 3 years is maybe experiencing some of those postpartum things. We can certainly get them into intensive programming in the next couple of days in a peer group with other moms.
Yeah,
hmm
that's really good because postpartum depression is a serious concern. You are listening to Mental Health Matters on the Jefferson Exchange. I'm Andra Hollenbeck. My guest today is Mike Pazzini from Charlie Health. He's a clinical outreach specialist and is joining us today to talk about youth mental health. So it sounds really good. It sounds like it's got a lot of flexibility, a lot of adaptability built into it to really help youth. What are the kinds of struggles that you find youth coming to you with? I guess what is the spectrum of conditions? Is it everything from anxiety to schizophrenia? Is it what do you find are kind of the major needs that come across your desk, or is it a really variety and all over the place?
We like to believe at Charlie Health that there's no one fit for folks,
Mm.
right? And each individual is given an individualized treatment plan. But I will say some of the things that are happening here in Southern Oregon are chronic and severe depression and anxiety.
Hmm.
That's going to be a big one. We have certain symptoms of bipolar disorders, as well as a unique angle in looking at disordered eating habits.
Ah.
Maybe for those individuals that have never been diagnosed with that, but are
Hmm.
showing maybe restrictive eating or overeating and purging and things like that, it's really hard in Southern Oregon to find treatment for that specialized a program, in
Yeah.
addition to it being more than weekly therapy.
Yeah.
So at Charlie Health, that's kind of one of our ways that we can get people into specialized tracks, right?
Yeah.
Is with looking at what they're diagnosed with.
That's really good to know because in NAMI we often hear from families that have where someone might have a really particular or unique kind of condition that they're trying to get help for and often have trouble finding. And it sounds like Charlie Health will have programs that are adaptable enough and that you create this individualized program that can really suit some of those more challenging kind of conditions that may come up.
Yeah, yeah.
Okay. So, what are your range of services? It's all, do you, I guess, for example, do you have people that do medication prescription and management, or is it strictly like the talk therapy through virtual um, therapy type situations?
The core programming at Charlie Health is group and individual sessions,
Mm-hmm.
and them being curated to you. But we also have add-on services, and that
Okay.
includes family therapy. Imagine a youth bringing in a chosen family member to help navigate their
Oh.
situation. And we also can prescribe some medications
Uh-huh.
as well. So we are a full scope virtual treatment facility,
Uh-huh.
that you're doing from the comfort and the safety of your own
Right.
home. And we'll certainly get you started or continued on whatever mental health journey you've been working on. When you leave Charlie Health, again, we're a short-term program. We're going to make sure that you're connected with a provider here locally that can continue prescribing those, that will
Mm.
reevaluate you, um, and hopefully you feel a lot better too.
Yeah, it does sound like it provides that particular niche between like a high intensive, like a hospital type stay, and regular outpatient, that this is kind of that middle ground, which is often really hard to find services and treatment for. So you do virtual services. What are some of the advantages and disadvantages of some of those virtual services?
This is definitely no secret that some people have a preference in the way that they want to learn and the way that they want to receive their help.
Mm-hmm.
And I meet with both doctors and therapists that say, "Hey, my people, they really want to be hands-on."
Mm-hmm.
And for those people, that's probably the best possible fit for them. But I also ask those folks, well, where are they going to get their curated, specialized treatment? And there's not a long list of those options here in
Mm-hmm.
Southern Oregon.
Right.
And so we try to always remember, although it may not be the modality that like you're most excited and prepared to do, we're still a very, very good modality that will keep you engaged with our like 90% uh, attendance rate into our sessions being about
Oh,
30-ish% higher than in other places.
yes.
People love coming to Charlie Health.
Uh-huh.
And I think that's what I like people to take away is that, yes, it's treatment. Yes, it's mental health. And we're using those words, but it's also a community of people that are trying to get better.
It sounds great. So they get that mutual support as well. So talk a little bit, you mentioned about family members being involved. Talk a little bit more about that and maybe share some ways that if there is a family member that is concerned or maybe their youth has had a kind of a crisis situation or seem like they're approaching a crisis situation, what would be some advice to those people and how might they engage with Charlie Health?
Yeah. This is a really good question. So, um, we want to make sure that people know that there are mental health resources out there, and we want to make sure that our youth are given a platform to voice how they feel. And I really think that youth these days are afraid of how adults, their parents, are going to feel about what they say.
Uh-huh.
So we need to always listen more than we talk. I think that's a very important piece that people take through.
And
But
that's a hard one too.
it's a hard one. It's a really, really hard one, but they're the ones going through these experiences. And I think in a clinical setting like a Charlie Health, that's what makes us so powerful is you can have a group of, say, youth experiencing the same things at school, getting in trouble, having like different agencies involved in their care. That's what we're here to help with, is to help people that really truly do need it most.
And it sounds like it can provide sort of a really safe, confidential place for teens. And I guess one of the things maybe family members could also do is make sure that they respect that space and privacy for that youth too when they start engaging in services.
Andrew, my most successful stories are when a family calls me about their child, and we also find out that the parent should do Charlie Health too. And
Oh.
so we have the whole family doing Charlie Health, of course, separate, but also together at the same time,
Hmm.
working on whole household dynamics and meal
Yeah.
times and
Oh.
homework and school and things like that.
Yeah, trying to
Absolutely.
rebuild that family community.
Definitely.
Well, tell us a little bit more, just quickly. We're coming to the end of our show, but how can people find out more about Charlie Health? How can they access services?
I want people to look up Charlie Health right now. I
Hmm.
want them to go online and I want them to read about what we do. I want them to ask their doctor if they know about Charlie Health. The last thing that I want, and I get this happen to me every week, is I get a family member in our hospital right down the road from here with a youth going in crisis, and they say, "I never thought that this would happen to me.
Hmm.
I never thought so."
Yeah.
And now we want to help people know that there is help for you. There's intensive help like Charlie Health. There's support from NAMI. There's other county agencies, that want to help you. You just need to start looking at it right now.
Right. And you're not alone in that journey and that process. And it sounds like Charlie Health is there to help with that. So that is our time for today. Thank you so much for coming in and sharing this really valuable resource for us today. This has been Mike Piazzini, a clinical outreach specialist with Charlie Health. Please find more information about NAMI Southern Oregon at our website, namisouthern.oregon.org, or you can email info@namisouthern.oregon.org. You have been listening to Mental Health Matters on the Jefferson Exchange. My name is Andra Hollenbeck. You can find us at jeffexchange.org or on Apple, Spotify, or wherever you might get your podcasts.